Good morning, everyone. My name is Cornelia Stevens. I'm the Executive Director of Top A Learning Centers and have the privilege of serving as the chair of the Early Childhood Recommendations Panel. I would like to welcome all of our panel members and thank you for serving Kansas children and families and our early childhood system. This is a remote meeting, so today's meeting materials are posted on the panel meetings website at kschildrenscabinet.org. Panel members will clearly identify themselves when they begin to speak. You have the option of doing the raise hand feature so that we know that you would like to speak. That way we don't miss any conversation that's needed. We are, for today's agenda, we just had my welcome. We are going to approve the October agenda. We will approve the September meeting minutes. We do not have anybody today for the Kansas Open Forum, but I'll talk a little bit about that in case anybody that's watching would like to share information with the panel. I'll give an update on the Early Childhood Transitions Task Force meeting that we had this week. We'll have a presentation on the DCF narrow market analysis, the Family Leadership Team and Family Advisory Council update. We'll hear from all of our work groups from the All In for Kansas Kids tactic work groups. We'll discuss bright spots. Apparently that's a tongue twister this morning. Bright spots. And so panel members, please, start thinking about things that you would like to share that I know that we have amazing things happening in Kansas. We'll discuss upcoming meetings and then we will adjourn so that we can then break out into our work groups. So the first thing is for us to approve our October agenda. So Lindsay did send out the October agenda. There were no modifications to the agenda. So may I have a motion to approve the October agenda as presented?
This is Tanya Bullock. I motion to approve the October agenda as presented.
Perfect. May I have a second?
This is Kim Kennedy. I would second that.
Perfect. All those in favor say aye or thumbs up. Any opposed? Perfect. Lindsay also sent the September minutes. Are there any adjustments or revisions to the September minutes? If none, may I have a motion to approve the September minutes as presented?
This is Natalie McLean. I'll make a motion to approve the September minutes.
Perfect. May I have a second? All those in favor say aye or thumbs up. Any opposed? Okay, perfect. So first thing on the agenda is to talk about the open forum. And so we don't have anybody present today to share information with us, but those of you who are watching live stream, we do encourage people in the community members to share information, anything that's going on within your community, any questions that you have, things that you would like the state to be aware of, etc. And so please submit your comments through the Kansas Open Forum comment form, which is on the Children's Cabinet website under the Early Childhood Recommendations panel. And that needs to be submitted by 5 p.m. the day preceding each meeting. And you can share written comments or sign up to share verbal comments with the panel during this portion of the meeting. Again, we don't have anybody sharing today, but here are the instructions if we have anyone that would like to share information with the panel in the future. I am going to now give a brief update on the Early Childhood Transitions Task Force. As most of you know, I am co-chair of the Governor's Early Childhood Recommendations Task Force, and we had a meeting this week where we are close to the end of coming up with recommendations for the governor. To give a little history, earlier this year, Governor Kelly actually formed a task force to look at streamlining and creating more efficiency in our early childhood system in Kansas. We know that there are organizations that have to write multiple grants, for example, for one program. We know that for families, sometimes it takes a little bit longer than it should to access certain services. There may be some duplication of efforts because different programs are housed in multiple agencies depending on the different populations. And so she formed a task force with the idea of doing something to make things more efficient in Kansas, which would as a result be better for children, be better for families, and better for the community and the service providers. So we had our second to last meeting this week. where our task force members had broken into work groups where we could come up with recommendations. So we heard from recommendations on programs, about what programs we feel should be consolidated or moved around within our state systems to create more efficiency. We talked about transition logistics. So when would this start? What will this, what's the beginning and what is the end look like? Who's going to oversee this? Really trying to put a structure together so that we aren't just kind of diving into this without having a beginning, middle, and end. And then we talked about metrics and data. What data do we need to collect to know that what we've done is effective, that we've actually accomplished the things that we want to accomplish? I don't have specifics in terms of programs, but that information is on Governor Kelly's website. The live stream is available if you want to be able to see the live stream of all of the information that was shared. But it was an impressive list of recommendations. And what that says to me is that all of the early childhood leaders were all really engaged and committed to looking at every nook and cranny within our system and trying to figure out what we can do to make things better for those who are impacted by those services. With our metrics and data, we want to make sure that people know that we have things that are going to be directly impacted by the task force, but we also have things that are hopefully long-term gains that are going to take the community, our providers, our children, our families in order to meet the desired outcomes. So all of the things that we track will not be things that are just going to be the result of this consolidation or redesign or whatever it will look like, but it will also be our community at large embracing our mission of trying to make things better. Our next meeting will be December the 11th, where in that meeting, we will have formal recommendations that we will review to then be able to present to the governor. And so it'll be very interesting to see where all of this lands. And honestly, if we check off all of the boxes that were identified in the state of Kansas, and the things that we can do to improve our early childhood system for the state of Kansas. It is going to be amazing for all of us on this task force, on this panel, but also for our children and families. And so it's been a really amazing journey in watching the transparency, the people who were, bold enough to talk about the what might not work and what will work, and then working together to really come up with solutions that I think will be pleasant to everyone. And this is not going to be something that will be presented as an executive order. They will have the legislature involved in deciding the structure. So the initial order was to create a new agency, a new state agency, and a cabinet level position. And but we don't know that that's going to happen. We're going to leave that up to our legislature and allow the legislature to determine whether or not it's going to be a new state agency, or if we're just going to kind of redesign and move some programs around so that we create efficiency and streamline services. And that's going to be the legislature that's going to make those decisions along with the governor. Do I have any questions or comments on the information that was shared? Okay, so if none, we will go on ahead and go to our first presentation. We have Nigel and Kate, who will be talking about the DCF narrow market analysis. So I will pass it over to you.
Thank you so much. Thanks for having us today. I appreciate you fitting us into your agenda. Nigel and I are working on this project, and we're kicking it off, and we're interested. We want to kind of orient you all. You may be really familiar with this work, but we want to orient you all and meet you and walk through this. We'd love to have your engagement in various stages of this process. So my name is Kate Young. I work at the Public Policy and Management Center, which is a center under the Wichita State University heading, and I will let Nigel introduce himself.
Hello, good morning. My name is Nigel Soria. I'm an economist at the PPMC and also the Research and Program Evaluation Manager. As Kate mentioned, some of you might be familiar with this project already. This study occurs every 3 years. And so for those of you who are familiar with it, we're hoping to get your feedback as we proceed through this process. And for those of you who are not familiar, we'll give a brief overview of what we're trying to accomplish for the state and DCF specifically.
So we will kind of have the project overview, talk about engagement opportunities, and then we'd love to hear from you all just briefly from the last experience, if any of you were engaged in the last market analysis project, and kind of we'd love to know what you thought and any suggestions you have moving forward. So I will let Nigel go ahead and do the project overview.
So for those of you who are not familiar, so this is a study that happens every 3 years to analyze and examine the distribution of childcare rates across the state of Kansas. One of the goals is to look at these rates and understand how we can establish parity among people in different areas so that they're effectively paying similar rates, whether they're in an urban area or a rural area. And part of this will be conducting a narrow cost analysis to understand, how much does it actually cost to provide childcare in the state of Kansas. We'll have access to a number of existing data sources, but some of this information we'll have to capture by asking providers through a survey. And the survey is sort of why we're reaching out to you to look at engagement and helping us capture everything that we need to capture so that it reflects your concerns as childcare professionals in the state.
Great. The engagement piece is what I'm tasked with, and that is a good portion of why we're here presenting to you today. This project, we want robust engagement from you all on the survey questions. You are the experts in this field, and we want to hear from you. So we will come back to this group if you'll have us with the questions designed so that you can give us feedback on them. But I'm also interested in building a kind of a separate steering committee, for lack of another word, that would meet just a few times over the course of the project, maybe three to 5 times, that we could kind of dig in a little more intentionally around the survey questions, and I could get some more feedback. So as you can see, this list here of who should be involved, it pretty much covers everyone. So we want a good spectrum of providers and agencies and organizations and caregivers, parents, anyone that wants to be involved. And that's kind of what I am building, is a steering committee that has each piece represented, so that we feel like it's robust enough to feel really good about the engagement. So if any of you are interested in serving on this, the time commitment will be minimal, I promise. It will be, these types of calls, probably 45 minutes each, 3 to 5 times over the course of the next year. Would you please email me or put your name in the chat or something so that I can know that you're interested in having even just another conversation about this process. So that's my ask. If anyone's interested and feels like they have a little extra time to devote to this project, I would love to have you on board. And then just simply, I will say that we will come back to this panel and any other organization that'll have us with the survey questions drafted so that you can give us feedback as well. So 2 asks there, one a little more dedicated time, and the second just a heads up that we're coming back to you so that we can hear from you again.
Yeah. So even if you don't raise your hand to be on the smaller committee, you will get to see the questions at some point. So it's been 3 years since the last study was done. Some of you may have been involved in that process. It was initially kicked off with Learning Tree Institute and then followed up by the Prenatal to 5 Fiscal Strategies group to look at that narrow market analysis. Obviously, we are working with Simon Workman and his team again to do this piece, but would be interested to hear any feedback you have if you were involved in that last study, things that you went well, things that you wish would have made it on that survey, or learning opportunities as we move forward, so that we maybe avoid any pitfalls that may have happened the last time.
So
maybe it'd be easy to just get people can raise hands. If you can raise your hand if you were involved in that engagement during the last narrow market analysis. I don't see many hands. Okay.
So it seems like that there was not anybody on this task force. Is that what I'm seeing that was actually involved in that? And so I think that that might be why we can't really talk about process or whatnot in terms of what happened, because we weren't directly involved. I did hear you say that you were going to involve Simon in the decisions, or at least in the work again this year. I know that I'm anxious to see what's happened as a result of the last market analysis, because I think that some of us are still, hoping to hear information in terms of what cost of quality was determined versus cost of care. And that was a conversation that we had. We had presentations by people initially when they started working with Simon, where what was discussed was we talked about care, but not so much quality. And so I've not heard yet the results of that. And then maybe could give more guidance in terms of going forward, what that looks like.
that's really helpful. Thank you for that.
This is Nichelle Adams, or Nikki with DCF. And Cornelia, I want to share, and I'll drop it in the chat, where the last market rate survey and narrow cost analysis is located and the results in there. So when we looked at quality, we looked at our links to quality project, which is not available yet across the entire state. And we also looked at our Kansas Early Head Start Childcare Partnership model to determine the cost of that, because we help fund that through DCF. So we needed to know those amounts. But when we talk about quality in the state of Kansas, we need a shared measurement, and that's what we plan to use links to quality for. So I hope that helps.
Pardon interruption, but I just wanted to make a quick note for logistics. We don't use chat for this meeting so that we can comply with Kansas Open Meetings records, because the public can't see our chat on Zoom. So Nikki, if you'll just make sure to send that to me, I'll make sure to send it out to all panel members with any additional information that would be helpful. And I'll also make sure it's posted on our panel SharePoint. For the public, if you do a Google search, I bet you can find it. So thank you.
Thank you for that clarification. That's great. Well, good. Go ahead.
I'm sorry. So perhaps we can share it, send an email out, Lindsay, with the report or whatnot, so that everybody can see all of that information if in fact I have not read it thoroughly. So confession here. And so so maybe we can send that out. But Nikki, I appreciate that. And so are you stating that if we're not involved in links to quality, those programs that are involved in links to quality will be what's used to determine the cost of quality, the data that's gathered from those that are involved in links to quality? Is that what I'm hearing?
Yeah. So I mean, so the results are used to help set rates, our child care assistance rates. So the initial results for the narrow cost analysis, and Nigel and Kate can talk more about that if you have questions, that are to look at what it truly costs to operate and meet the licensing, health, and safety requirements. So that's like the first thing the narrow cost analysis looks at. So those we use for our base rates typically. So from the last market rate analysis and narrow cost analysis, we're still making our system changes to increase the rates to reflect what it truly cost. We also did some grants out to directly to providers that are receiving child care assistance to pay the difference from what we found from this last survey because of how long it's taking us to make our system changes to update those rates. Well, those rates should be updated. I believe they're going to be in April of 2024, but we'll use this new information to also set rates. We'll plan to do tiered differential payments for links to quality. So that's why we'll look specifically at links to quality, how much it costs to meet those indicators.
Perfect. Emily?
So I'm trying to make sure that I'm understanding this correctly. The information that we're using is from the narrow market analysis that was completed 3 years ago. So the information that we're using is pre-pandemic, correct? Am I understanding that correctly? That like, are we using information from 3 years ago as a baseline, or how is this working?
So it's not pre-pandemic, but it was 2020. So yeah, it was during the middle of it. And so yeah, I mean, that was the last market rate survey and narrow cost analysis. So this new one is going to be current. It's current information.
Okay, but and the new one is what? Has it already begun, or is it beginning?
I'll let Nigel and Kate take back over.
There you go. Yes. I'm sorry we hijacked your conversation. I'm sorry, Kate and
No.
Nigel. We just went a totally
No.
different direction. So sorry about that.
Yeah, this is a full conversation. Yeah, so it has begun. We're engaging.
Okay, I'm just trying to make sure I'm understanding what we're looking like, what numbers we're actually talking about, and how the comparison is going to be made.
So we will be looking at what it currently costs providers to provide childcare in the state of Kansas and how those rates are distributed across the state. We will compare that to what was found in the last market rate study, but in terms of how that gets implemented, I think that's what Nikki was talking about. But yeah, I mean, the goal will be, to provide the current cost of providing childcare to the state, and then however that gets translated into updated rates. That's I'm not sure what that timeline looks like.
And then we have the questions, of course, from the last study that will help inform this next round of survey questions that we will build in the next 2 to 3 months, I would say. And so just as a kind of orienting of what the next couple months looks like, we'll be building those and then kind of pitching them back to you all and other groups that have that are involved in this work. Well, great. Well, this was helpful. Does anyone else have questions, comments? Seeing that you weren't involved in the last one, I want to make sure that we are as clear as we can be. So does anyone else have questions? Okay, great. All right, well, thank you so much. Reach out to either of us if you have clarifying questions, or again, I've seen some emails come through, so thank you for those who are interested in pursuing this more. I appreciate your time, and I look forward to getting to know everyone better and orienting around this work. So thank you.
Thank you both for the work that you're doing and helping us determine, the best rates possible for providers, children, and families. And so it's a lot of work. I know it's not easy and to do all of this work. And so thank you for all of that. And thank you, Nikki, for hopping in and again, creating an opportunity for us to give feedback. Very good.
Thank you for having us.
Absolutely. Next on the agenda, we have Cora Unger, who will give an update on the Family Leadership Team and Family Advisory Council.
Cora, I can see that you're in the meeting and that you're off mute, but I'm not hearing anything. I'm not sure if your sound is working. Does anyone else hear Cora?
I do not hear Cora.
I'm trying to look for the picture.
I see her, but I cannot hear her. I see her talking.
Yeah. Oh no. Oh wait. Can you talk, Cora?
Yeah. Can you hear me
Okay,
now?
yes, we can.
Okay.
Great. Okay.
Well, okay. I have no idea what was going on because I haven't changed really anything. I was just looking at my settings. Sorry about that. Good morning, everyone. My name is Cora Unger, and I'm the Family and Consumer Partnership Program Coordinator at KDHE in the Bureau of Family Health. Okay. So the program that I'm working with is newer, and we really come from a nothing about us without us mindset. Okay. Thank you. So I'm going to start out talking about our Family Advisory Council, which stems from the Title V block grant, which is for maternal and child health. Under our Priority 7, we say that we will have strength-based supports and services that are available to promote healthy families and relationships. And so our Family Advisory Council was originally formed in 2009 with a specific focus on families who had children with special healthcare needs. That council could support up to 12 members. During 2020, after seeing how amazing the work from our families was, our leadership wanted to expand the council to cover all 5 of the core MCH domains. And so now in 2023, we are mostly fully on our feet. We have 5 work groups and currently 38 amazing members. So, as I said, in 2020, we developed our expanded council. In 2021, we started with recruiting for all 5 work groups. And then by 2022, in January, we were able to launch our work groups. So this council has grown a lot since we originally set about expanding it. And we really envision a state where we are engaging families in program planning, evaluation, service delivery, and policy development, as well as partnering with them for advocacy and building up leaders in our communities. Next slide. So we meet 4 times a year currently. So we're meeting January, April, July, and October. We meet 2 of those virtually, which are January and July, because weather in January and people like to travel in July, especially when you have families. Those meetings are a little bit shorter. And then in April and October, we meet in person. Those are longer meetings. It's a lot more work to get everyone together in person. And we move that location around the state so that no family has to travel too far. We also provide them a stipend for general participation. When we meet in person, we help to support them for travel. If they drive over 150 miles, we pay for a hotel for them. Just try to make it as easy as possible for families to come and participate. And then we also offer additional stipends for both in-person and virtual, things like childcare to help cover the costs. So when our members are with us, they can fully participate and not have to worry about taking care of their children as well. So one of the core things that they have been very helpful with is they help review our Title V MCH state action plan. And what the work groups do is they look at the domains that are broken out in there that are affiliated with their work groups, and they pick a project to work on that kind of helps move that work forward. But it's something that they choose, that they are interested in, and they want to help do something about it. And so those projects can look like a recommendation. It can look like a physical product, like a brochure or pamphlet, or they've even gone so far as to help us redesign our programs at KDHE. And they also help develop a whole new program. So we can move on. So as I said, they help us work with our Title V 5-year action plan. And they give us ideas, they help provide feedback, they help us when advising. They give us the family voice, the voice of somebody who is actively living that phase of life where we know what is helpful, what's not helpful, because at a program level, you can design whatever you think is helpful, but unless you talk to the people who are actually going to be using that program, you don't actually know. And so you can design something like, this is amazing, everybody wants it. And then you put it out there and nobody uses it because it's not something that they really need. So they have been very helpful with that. So yeah, we can move on. Our current membership is here. So our goal is to have 7 to 11 members per work group. We have had some turnover, of course. I'm sure everybody is familiar with trying to get groups together and people join on and then life happens. And for a variety of reasons, they have to step away. At one point, we did have 44 members for a brief period in time, but then through renewal of membership and life, we're now down to the 38 members. But our members do represent families across the entire state. There are parts of the state where we have less members that we would love to recruit more from, but we really want all the experiences that we can get. So, and they have been fantastic. All right, so we do have plans for growth. We did just grow huge from, I think when we first started expanding, we had 10 members and now we have our 38 members. But we do want to build out a youth advisory council that will have the voices of youth across the state. We are in discussion about that. So hopefully by next year, we'll have some sort of plans to take action and get their feedback on the same things to make sure that we are supporting them in the ways that they need. We also want to focus on creating a fatherhood work group or focusing more on recruiting men to join the council. We have in the past had a few men on our work groups or on the council, but not as often. So we really would like to bring more of that voice in as well. So either that's going to be creating their own work group or just focusing on recruitment to bring them in for all those different domains as well. All right, so I'm going to move on to talk about our Family and Consumer Partnership Toolkit. This was something that the FAC helped us develop back in 2021 while we were in the process of recruiting for the council, and we held some roundtable discussions with them at the time and asked them all sorts of questions on how best to partner with and get feedback from families. We pull in different national frameworks as well. And are working on expanding the tools and resources available to programs. So our document and now the website is up on the Kansas MCH website so that you can find it. So here's what the website looks on the main page. And then if you go down to the Family Advisory Council and you go down to Family and Consumer Partnership Toolkit right there, that is where you can find it on the Kansas MCH website. Like I said, I'm still building out tools and like one sheet informational pieces to go on there. You can progress. Thank you. So yes, as I said, we're developing more info sheets. We will be finding tools because there are several tools out there that exist that can be helpful, that we don't have to recreate the wheel. And then if we can't find those tools, we will develop them to help fill gaps. What we would love is to hear from people who are interested in using the toolkit, what is not up yet that they would like to hear about or know about, or what they're looking forward to seeing added onto there. And then eventually, after we get more of that built out and up there, we will be developing some technical assistance for community partners. And as always, with any of this work, it is always reviewing, listening, and making updates and changes as needed. So if we put something out there that doesn't work or needs like revision, we will figure out what revision needs to be made and update that. All right. Okay, so I know we are a little ahead of schedule. I started a little early, but so the family leadership team, I have spoken a few times about the family leadership team. I believe maybe a couple other people have as well. So just as a review for anyone who was not on here before, the family leadership team was developed originally out of the preschool development grant that we got a couple years back. The goal was to include different state agencies and groups to come together and who work with families, as well as bring in families as well, so that we were bringing that family voice to the table with the people who kind of make all the big decisions for their programs. Through time, that has changed in the model that we wanted to do. And so we are on probably our 4th revision of our plan, which is going to be a series of roundtable discussions where we can bring in families across the state and we can come with our questions and they can come and give us feedback and actively participate in those discussions. And then we will compile that feedback and we will create some formal recommendations based on what we hear from them. And we are hoping that through doing this, we can help show actively how the family voice and partnering with families can be so beneficial to the programs across the state, and to really model it and show that. So as I mentioned, we do have our roundtable sessions. We are going to be holding our first series of those November 4th and November 6th. This is open for registration right now. It's on the All In for Kansas Kids website. We're really excited about this. We are taking some of the conversations that KU CPPR had with families in the spring, and we are taking one of those ideas so that we can bring that back to the families, get more information, and create something out of it to, you know, show that path from like, we heard you say this, what do we want to do about it? Okay, now we're going to create this with your help. So I'm excited for it to see. It's a little different than my usual work with our Family Advisory Council. And yeah, I'm excited to see how this goes. So thank you. And if anybody has any questions, I will do my best to answer them. If not, you can always email me as well.
With no questions, Cora, thank you so much for the update
Yes,
and
thank
the
you.
information of your work, and so excited to see as things evolve and whatnot, and looking forward to the fatherhood especially. So that's very cool. Thank you.
Yeah,
All
thank
right,
you.
so next we are going to have updates from our All In for Kansas Kids tactic work groups. So we're going to start with tactic 712 on local zoning.
This is Emily Barnes. I know that Jarvis is in here, so Jarvis, hop in if you want to. We had met, I'm going to be honest, I don't know that we collaborated before showing up here today. So I apologize for that. We had met in September to kind of, pun intended, zone in on our recommendations and get a little more firm on where we were going with it. We had a really productive meeting with Melissa Rooker, and where we could kind of talk a little more in depth on where we're taking that, kind of get some clarity on who the targeted audience is. You know, there's discussion around community toolkits that, you know, for, you know, like when regions have created childcare coalitions to address what's going on in their area. And so I know that whatever we do going forward will kind of be based on, not kind of, it will be based on the work that we have done. It was toward the end of September when we met. And so we'll take that kind of clarify who the target audience is, figure out if there's recommendations on how they're supposed to use things, you know, the steps to go forward, and then utilizing the different associations, you know, like there were some associations for like, you know, local governance, you know, for zoning and things like that, that we'll be continuing to reach out to figure out the best way to move this forward. Darvis, did I skip anything, miss anything? Is there anything else to add?
No, I think you did good. I mean, yeah, you summarized everything really well.
Okay.
Kind of
All right.
some spots we're waiting on right now. So
Right.
Yeah.
So that's us. And if anybody has any questions, I am very happy to answer those questions.
Okay, thank you, 712. How about 615, document and address recruitment and retention challenges?
Hi, yeah, this is Amy Gottschammer, Google's Learning and Tactics 6.1.5. So we had our meeting, well, we had a middle meeting. Actually, I guess hopefully I have all of this in one place. Our most recent meeting, we started looking at the document ourselves. So we've been reviewing the this document that we created and trying to kind of make it a little more thorough, usable, more organized. So we created that introductory page. We reviewed that, made some tweaks to it on Monday at our meeting, and felt that we had kind of fine-tuned that a little bit better. So we were happy with that work. And we got into some sort of side discussions, which were more to the addressing of the problems, which are all good. And we added those suggestions to the document as we went. So it kind of was a combination of adding to the document as well as the creation of the document. So we have kind of two things going on at the same time. Another thing that we also discussed was in our tab number 4, which is our perception of the work, where we're talking about how many people in society don't really value the work of early childhood educators. We got into looking at marketing campaigns that are currently being used at the K through 12 level. The Educate Kansas campaign in particular, the hashtag Inspired to Teach, and really looked at how that might be just tweaked for the early childhood field and could maybe be repurposed for us at some point. So that was one thing we were looking into. We also discussed subpools. We looked at that in terms of the aspect of how that improves retention has to do with, in one part, creating supports for mental health, because subpools allow people to, especially home providers, to be able to get out of their homes, take a mental health day, go to the doctor, take care of their own physical needs, things like that. It also allows providers to step away from their classrooms and sort of elevate themselves in terms of professionalism, be able to be a part of a meeting of a board or a local committee or something like that. So elevating themselves professionally is another way to retain providers in the field. So all of these things are again, parts of the recruitment and retention piece. So we looked and had some greater discussions about what subpools could look like. And so we added that to tab number 2, professionalizing providers, and tab number 6, mental health supports. And we did not yet get to a topic that we will discuss further today, which was kind of fine-tuning the audience that we hope to target, whether it's really looking at the providers or other professionals. And then we also kind of went down a little bit of a discussion on how we could look at the recruitment piece in the high schools and CTEs and the career pathways. So that we're going to follow a little bit more as well. Anybody in our group have anything to say, anything I left out? Sorry, I was speaking quickly, but I didn't want to take up too much time. Anybody have any questions for us I can answer? Okay, well, our next steps are pretty much to just continue down the same path. We want to keep fine tuning this document, but we find ourselves as we have discussions that we kind of go down one rabbit hole and then another, and then we want to add some more things to the document. So it really is very much a living document, and that is its purpose to a great extent. That we want people to find it to be a usable document, and that they can go in, they can, as an agency or a group or organization, they can say, hey, here's a really usable thing for us. This is one way that we can really improve recruitment for our school or our program. And so we want to flesh this out. And here's an idea we found in this document, or another group might want to do several things for a region or something like that. So, more ideas that come forward, I think, are all to the good. And so as they bubble up, we want to add them to our document. So that's kind of where we are. All right, well, that's all we have then. Thank you.
Very good. Thank you, Amy. Let's hear now from Tactics 611, compensation and benefits.
Good morning. This is Heather Schroberger. Our group, since meeting last month, continued our conversation somewhat via email. We're trying to move in a more concrete direction, I think, with our recommendations in this area. So we're focusing on putting together a vision of how we see an aligned competitive compensation system so that can inform our recommendations. We finalized mapping out the components of a compensation system, which then led to a revised proposed definition. So today, I believe our plan is to finalize that definition and start to outline a framework for potential recommendations by each component. At that time, I think we'll be ready to seek some feedback on that definition and the framework. We are still having some ongoing conversation in our group about kind of at what level our recommendations should be, how concrete, should they be more aspirational or next step type recommendations. So that will be the focus of our discussion today. Does anyone from that group want to add anything? Or any questions for us? Okay, thanks.
Perfect. Thank you, Heather. And lastly, we'll hear from strategy 4.2, family-friendly workplaces.
Hi, this is Melissa Martin reporting for us. Our first piece of information is just an FYI that Dana Book is our new lead for this committee. And we have continued, we had a great deal of feedback on our original recommendations, much like the other groups. And so we are continuing to work through that. We do feel like we have actually now want to rescind one of those recommendations to make room for a more specific recommendation that goes a little bit of a different direction. We had also been told that once upon a time, the Department of Commerce had some family-friendly recommendations, but one of our members researched that with everybody she knew at Commerce, and no one had any memory of that. So we are proceeding as if that has not, in fact, existed. So one of the things we also have identified in the process of trying to create our new recommendation around the website aspect or online information is that how to educate our relevant audiences, the educators, the employers on both the public and private sides, as well as families, is a big consideration in any recommendation that we make. So we expect today to add some concrete to a recommendation that there be an area on the Department of Commerce site specific to employers for the family-friendly workplace information, and that for families, there be a place on the Children's Cabinet website that is specific to the families with the children in question. Also today we have joining us, Vicki and Dana are going to talk with us about K-pop today, Kansas Power of the Positive, which at least a couple of the members of our group have, work with. And so we're continuing to move forward and want to really get some final recommendations made. And our intention in our meeting time together today is to really determine how to move forward on those recommendations and then further along. Any questions or anybody else from the group want to comment? I know we're a lean group today. We have several folks traveling and out.
If none, thank you, Melissa. Thank you for the update. Very good. Always exciting to hear updates from our work groups and hear of the work that's happening. And as we're hoping to shape and guide, give recommendations and whatnot, for our strategic plan. So you have had since the beginning of our meeting to think about bright spots. And so please share good news, things that are happening within your program or your community. Who would like to go first? Natalie?
I just want to bring up that we've got our first draft of the updated Kansas Early Learning Standards out for public comment. If anyone would like to see what we've got for a first draft and comment on that, provide some feedback, you can go to ksde.org. And in the banner, there's a scrolling banner. There will be a big announcement. You can click on that, read it, provide written feedback, or there will be a live Zoom meeting on October 30th from 4 to 5 that you can provide spoken feedback if you'd rather do it that way. We'd invite everybody to check them out and give us some feedback.
Very good. Next. Jarvis?
Yeah, I just had a couple things, both tied to regulations. We have finished our part of drafting the big set of regulations we were working on. We sent those over to the Attorney General's office about a week and a half ago. So that's part of the formal promulgation process. So they're out of our hands. There will be additional opportunities for public comment in the future, but just want to let everyone know those have been moved out of our agency. So, and then also through that process, we identified the school age programs and our drop-in programs. Those regulations were in need of a large overhaul too, and we really want to do something different with those. So we actually had our summit with we invited school age programs and drop-in programs to Topeka last week and had a summit. It was really enlightening, and we had some very good discussions. So we're able to take some notes from them, and we have started working on some updates to those regulations. And actually this morning I had left that meeting. We have a 3-hour meeting this morning. We're on starting to draft those. So I left that meeting to hop on here. But yeah, we've started meeting. We have 3 meetings already this week working on regulations for that. So it'll be the same process with that. We'll draft things and then get feedback kind of like we did before with that other set. So just wanted to put that out there, let everyone know what our agency is doing with our regulations. So thank you.
Thank you. Brenda?
Thank you, Cornelia. Can you hear me? I'm using my Bluetooth speaker. Thank you. Okay, so I'm Brenda Bandy, Executive Director the Kansas Breastfeeding Coalition, and we have a couple of SHRM to present at their Employment Law and Employee Benefits Conference. And Cornelia or someone, please let me know if my voice gets wobbly. I just got a sign my internet's not stable. I'll turn off my video in case that helps. But this will be an opportunity on February 22nd to speak to HR human resource managers about employment law practices and family-friendly practices. Also, we will be exhibiting at the Kansas Association of School Boards to talk to them about family-friendly practices. And last announcement is that Kansas was selected by the Prenatal to 3 Policy Impact Center to attend a paid family leave policy academy, the long title, in November. And there will be a team from Kansas attending that policy academy and bringing back what we learn about paid family leave to Kansas.
Very good. Thank you, Brenda. Any other? Bronwyn?
Good morning. I hope my speakers are working this morning. I've had some trouble with them as well. Can you hear me?
Yes.
Very good. Thank you. I'll just give some quick updates with regard to the career path, the implementation of the career pathway project. We completed 17 interviews with over 200 individuals from across the state, workforce and association members, members of state directors and others, to inform the work of the implementation of the career pathway. Had some very, very good enlightening feedback, and implementing those comments and ideas into the implementation plan. Also share that we are working on creating a survey. Actually, it's part of a comprehensive workforce study, and that survey should be launching, we hope, November 1st. Taken us a little bit longer to ensure that we have all of our ducks in a row, so to speak, and that all the questions are well worded and relevant. So that will be going out here hopefully the first week of November.
Very good. Thank you, Bonnie. Any other bright spots or information to be shared? Okay, if none. So we do look for agenda items or whatnot, or people who would like to speak at future panel meetings, and we would encourage any panel member that is on a early childhood governance group that has information that what they want to share or whatnot, to please reach out to Lindsay and ask if there's things that are happening with other outside groups or whatnot that need to be shared with the panel. We would love to be able to hear from you so that we can kind of coordinate efforts and know what's happening across the state. Our agenda items, again, are available on the panel share hub that is sent out to all of our task force members. So this is a point of discussion in terms of our November 17th meeting that I just kind of wanted to pose and make sure that we are either make decisions in terms of that meeting. November 17th happens to be one of the dates of the NACCE conference in Nashville. And I don't know how many of us are planning on going to NACCE. And so I'm trying to look at attendance and what that will look like for the meeting. That also happens to be the week before Thanksgiving. And so I kind of wanted to have some conversation on whether or not we need to look at changing the date for the November meeting. Do we need to cancel the meeting, or do we have enough people who will be present, where we can just have our meeting as planned? Any thoughts from our panel members? Any preference one way or the other?
This is Brenda Bandy, and I would prefer to reschedule. I will not be available on the 17th.
This is Tabitha Rasbright, and I am open for anything.
There you go.
This is Emily Barnes. I will not be attending NACCE, and so I'm open to any option that works best for the group.
So Lindsay, what it seems like then is that majority of people are flexible and can be present. I'm not hearing a lot of us stating that we'll be gone. And so I will not be in attendance on the 17th, because I will be attending NACCE. But Lindsay has volunteered to take over the lead for that meeting. And so thank you for a discussion. I didn't know with the holiday and then the conference, how that was going to impact things. And so the November 17th will continue as scheduled. We also will have our Children's Cabinet Trust Fund meeting on December 1st that is going to be live streamed on YouTube. So we're going to take a 10-minute break. And so it is 10 o'clock on the dot. And so if you can come back at 10:10 and then move on to your work groups so that you can have continued conversation on the good work that you are doing. So thank you all for joining our meeting this morning. Thank you for the people who have given presentations. Always good to hear updates and things happening with Kansas. You all have a great weekend, and work groups will see you soon.